You could spend part of this lovely rainy day with us today. My name is Julie Moskalik, and I'm the Science Director at Science North, and I'm so pleased to be able to kick off the final of our Let's Talk About COVID-19 series, the effects of the pandemic on health sciences, research, and innovation, with a focus on how COVID-19 will influence our community and society in the future. We have a great audience so far. We have an incredible group of panelists, so we're really looking forward to spending some time with you this morning. Bienvenue, Annie, Kwekwe, Wache. We're so happy to have you here with us, and it gives me great pleasure to welcome everyone on the call. I can already see that some of you have been to our previous sessions. We've had people from, of course, all over the city of Greater Sudbury and far beyond. But to begin today, it's very important that we acknowledge the Robinson-Huron Treaty of 1850. We also further recognize that Laurentian University and Science North are located on the traditional lands of the Tsikmiksheng Anishinaabeg, and that the city of Greater Sudbury also includes the traditional lands of the Wanapitei First Nation. Nous désirons commencer aujourd'hui en reconnaissant le traité Robinson-Huron de 1850. C'est important aussi de souligner que l'Université Laurentienne et Sciences Nord se trouvent sur les terres traditionnelles des Premières Nations de Tsikmiksheng Anishinaabeg et que la ville de Grand Sudbury comprend également celle de la Première Nation de Wanapitei. This is the very last of our 6th series part of Let's Talk About COVID-19. And we've had such a pleasure of opening our community dialogue with literally thousands of people in the last 2 months. And if you missed some of the previous series, they are on our YouTube channels, and they are really incredible content. Despite the challenges that we've been facing, it's been amazing how we've been able to come together collaboratively to use this great technology in a way that we really couldn't have imagined. You know, at the beginning, we weren't sure how it was going to go, but we're very happy at how it all turned out. And as the Science Director at Science North, where we specialize in science communication, seeing the engagement and the willingness of exceptionally talented staff, especially from Laurentian University and beyond, engaging faculty to support the fight against COVID-19 has been really inspiring for people to see. It's great to see the work that everybody is up to. I'm looking forward to hearing from our panelists today and hear their thoughts and insights on how COVID-19 will influence our community and society, not only now, but also in the future. I am not your full host today. I'm so thrilled that we have a special guest hosting today's session. Dr. Thomas Merritt is a professor in chemistry and biochemistry at Laurentian University, but we have just been thrilled that Dr. Thomas has been with us since January as Science North's first scientist in residence. Thomas has been working with our team at Science North to augment our science communication around his area of specialty, but has stepped in to lead many initiatives and will facilitate and guide us through the next hour. So thank you, Thomas. I am going to hand it over to you.
And I was muted, so we're off to a great start. Thank you, Julie. Good morning, everybody. Welcome to the last talk in this series. My name is Thomas Merritt. I'm a professor at Laurentian University, and I'm really thrilled to be a scientist in residence at Science North. I'm even more thrilled to be part of this event this morning. We have 4 wonderful speakers from a diversity of different research backgrounds, and they're all going to give us a different perspective on what it means to do research in the middle of a pandemic and what the pandemic is going to mean to research going forward. As a researcher myself, I'm really excited to hear what everybody has to say, and we will hopefully hear from you as well. As we have a venue for questions, please post your questions in the comment section on Facebook or YouTube, however you're watching this, and then we'll address those at the end. So we'll go through all 4 speakers, and then we'll come back to a question session. Each panelist will have a short presentation, so we'll go through each 4. I'll introduce each, and then we'll come back for that Q&A session. Please do note that the questions are going to come from different platforms, and so I'm going to do my best to make sure that we get all of those and we address everybody's question in a really exciting fashion. All right, our first speaker this morning is Dr. Mary Catherine Kerr. She's an internist and intensivist at Health Sciences North. Dr. Kerr has a keen interest in multidisciplinary medical simulation, development of simulation-based educational resources for rural and remote healthcare workers in Northern Ontario, and in improving that overall process. Dr. Kerr, if you would join us and start with your remarks.
Thank you, Thomas, and thank you for the opportunity to be here amongst such an accomplished group of people. From my perspective, I'm actually going to add a bit of the health sciences perspective and starting some research into educational models in the middle of pandemic. I want to speak a little bit of how COVID-19 has radically changed how we educate the medical community in all of Northern Ontario, and how we're planning to study these innovative learning systems that we've developed basically out of desperation in the middle of a pandemic. So I wanted to start off talking to you about how do we normally educate an institution or a region about medical changes. And the first thing is that our typical educational model or system is that experts choose one particular topic to review. So for example, we may speak about code blue. And so when changes come out in the literature, we might talk about changing our protocol in the institution. When that happens, we very carefully make new content, and then it's rolled out to teach the entire institution. And once it's complete, we review the next change. So we try to do this one thing at a time. What we notice is that this process is very deliberate, it's careful, and it's sequential. Now, COVID-19 has dramatically changed that. I want to talk to you a little bit about what is medical simulation in education, in case you're not familiar with that. So it's basically a fun, fast-moving, exciting, high-fidelity educational tool that accomplishes multiple things. The first thing it does is it simulates a real environment. So there's a quick photo to show you, which may be helpful. This is a simulated scenario where you have a fake patient, which is a mannequin, but everything else people use is the same. You have all your coworkers working with you, you have simulated medication and supplies, and you can do the things that you would normally do to patients. So participants get a chance to practice stressful scenarios and also technical skills without the added worry of harming any patients. And so there's actually very big buy-in. It involves a core group of learners and faculty who are in very close quarters with each other, and it simulates real life, like the emergency department, for example. Due to the high fidelity nature of this, the number of people that can run through it at any particular time is quite limited. So it's quite labor-intensive teaching tool, but we often use this to try to do some of our more high fidelity teaching. So enter COVID-19, and how has this all changed? So as you know, COVID-19 is a novel respiratory virus that's made it all the way here from across the world. And we found ourselves in a really unique position of being able to literally watch this virus through mainstream and social media make its way from across the world to our very doorstep. So we in the medical community had the impression of an hourglass with sand trickling through quite quickly and our time to prepare really running out. It was a very unique situation in that it brought real fear. And so there was fear of healthcare worker transmission, worry, am I actually going to contract this disease? Will I bring it home to my family? Will I see my coworkers get sick? We saw what was happening in Italy and other places, and we wondered if we would have the stamina to get through all of this. Healthcare workers were actually writing and updating wills, and it was very stressful. We saw the accounts of insides of hospitals and the tallies of healthcare workers that were sick, and so it was quite terrifying. But as we probably know, fear is a very great motivator, and this actually fueled a very rapid regional educational effort with unprecedented buy-in. And this was aimed to reach everyone as fast as possible in Northern Ontario. So normally when we teach or when we roll out new curriculum, we have some content that's very, we've worked up the content, made sure it's very good, and then we roll it out or simulate it. In this case, there was not just a need to teach, but there was actually a need to develop new ways of doing what we normally do to be safer. So for example, if we were talking about intubating a patient, putting a breathing tube in, performing cardiac arrest, or transporting these contagious. So what actually happened? Well, what happened was that a group of skilled, highly engaged individuals from multiple departments came together and transformed an educational system. Everyone was united in a common enemy and fueled by Zoom meetings, somewhat like this. And we encountered some challenges. So I wanted to walk you through a few of those challenges. The first was that we had this traditional simulation teaching model, and we also had new social distancing practices. So we quickly learned that, can you imagine running an entire institution through this small, intimate group teaching sessions? That would take forever, and we didn't have that kind of time. And so that was problem number one. We talked about that maybe we should fan out our teaching initiatives, but the concern was, as you might remember playing telephone as a child, that we were worried that the core group might have made a really good curriculum, and by the time it fanned out across a whole province or institution, that it may change the message at the end of it. And we wanted to make sure that our message was concise and consistent. So we were forced to be quite innovative, and the answer came as virtual meetings similar to this, some branched out teaching, but we also created some videos. So we were trying to use virtual learning platforms. One was videos where a core group would do the actual procedure, and then it could be disseminated very quickly to everyone with standardized content. Secondly, the Ontario Telehealth Network allowed us to host some virtual teaching sessions with question and answer periods across the region, which was very helpful. And all of this work was supported by Health Sciences North, the Northern Ontario School of Medicine, and the Virtual Critical Care Network. A second challenge is that we forgot that we were also human. And so one of the members was actually isolated for symptoms of a cold early on, which basically incapacitated our teaching sessions for a short time. Again, we were forced to be innovative and to be more cautious with social distancing practices and then move into more virtual realm. Thirdly, we needed to have an adaptive, responsive, and responsible educational system because, as you can also remember, every hour we'd have new information on media, we'd have new research suggesting how this disease was transmitted, and so our content had to change regularly. So we developed a website updated by a core group of people that could then update the content that was disseminated out quickly. So it was a very responsible educational model. And in addition, we had to change the mindset of people, which you can imagine is not super easy to do. And the reason for that is that people were thinking if you change things too quickly, you may not know what you're doing. But in this case, we were actually just being responsive to a changing world. Fourthly, we needed to engage the right decision makers. And fortunately, administration was quite good and approved things with lightning speed to help move this process along. So to kind of summarize, how will COVID-19 change education dissemination models in the future? We're trying now, with a bit of downtime, hopefully, to review the successes and challenges that we experienced through interviews with core people and kind of solidify this robust, rapid educational model. And hopefully we can transition to adapt that to future catastrophic scenarios should they occur. We're moving away from in-person large attendance events and transforming more into virtual platforms. On a positive note, we know that COVID-19 has done a lot of awful things, but out of a common plight has come unprecedented collaboration and rapid positive changes in institutional learning that we've seen in Northern Ontario, and hopefully a preparedness and confidence among healthcare workers that can be transitioned into the future. It's highlighted the importance of simulation for learning and taught us that knowledge is transferable in the virtual world. And finally, and maybe most importantly, on a positive note, it showed us the power of collective work, the good in humanity, and the willingness of individuals and groups to unify and work tirelessly and take time away from family in many instances. And all of this aimed to really increase the preparedness and confidence of healthcare workers and enhance safety of the healthcare workers and patients in Northern Ontario. Again, thank you for the opportunity to share my experiences.
Dr. Kerr, that was fantastic. Thank you so much for sharing that with us. I love the way that you started off talking about watching this pandemic spread. I think that we all lived through this, and that really speaks to the common experience that we've had. And I also really love the fact that you ended with the idea of this cooperation as we explore new ways to deal with our new reality. Right? That's just really awesome. Our next panelist this morning is Dr. Amedeo Peresanti, who's a molecular biologist and professor in the Department of Chemistry and Biochemistry, where I am at Laurentian University, is also professor in the Division of Medical Sciences at the Northern Ontario School of Medicine and a senior scientist at Health Sciences North Research Institute. While his research interests are in identifying tools to improve chemotherapy in cancer patients, he's developed an interest in establishing regular surveillance of the system for COVID-19, something that we're all really interested in. Where is this virus and how is it spreading? And he's been specifically looking at that spread in the city of Greater Sudbury. So our next speaker, Dr. Amedeo Peresanti. And you're muted. And you're alive.
Thanks, I'm still getting used to Zoom after 2 or 3 months. Hard to teach an old dog new tricks sometimes. Anyways, thanks, Thomas. There can be little doubt that the COVID-19 pandemic has really dramatically impacted almost all aspects of our daily lives. And this virus has impacted our work lives, our social lives, our family relationships, our mental health, and for many, the financial impact on personal and business finances has been unprecedented. And so this virus has also presented caregivers and healthcare providers with new ethical dilemmas when multiple patients and healthcare staff require limited resources. So we're really grappling with this. But what is often less known and less understood is how the virus can impact research and innovation, particularly in the life and clinical sciences. And during the height of a pandemic, and often in other challenging times, a popular argument is that research is a luxury and limited resources should always be directed to the care of the ill and to the support of all essential workers. And in many respects, this makes perfect sense. But the COVID-19 pandemic presents us with an important dilemma. Research involving COVID-19 clearly requires personal protective equipment, and as such, COVID-19 researchers, COVID-19 surveillance study. The goals of the study are to quantify the prevalence of asymptomatic and symptomatic COVID-19 infected persons in Sudbury, and to assess the effects of normalization of business and population activities on the prevalence and transmission of the virus. And those testing positive for COVID-19 would then be contacted by our local health unit to require self-isolation and to begin the process of contact tracing and testing of the contacts of COVID-19 infected patients, all the things that one would expect one would have in a surveillance system. And all COVID-19 infected persons would then be advised on how to successfully quarantine at home without infecting their housemates. They would also undergo a brief health assessment, be provided with advice on ways to monitor and maintain lung health, and also the use of digital oximeters, these units that you place on your finger and that allow you to monitor for the presence of hypoxemia, where your lung capacity and your ability to provide oxygen to the body gets less. This could then help prevent a failing patient from requiring a ventilator or a hospital or intensive care unit admission. So few would argue that these aren't laudable goals. But at the time, and to some extent currently, testing reagents and supplies are quite limited. So how does one balance the need for items to conduct COVID-19 related research with the need for similar items to clinically manage patients and to protect our healthcare providers? Well, a recent editorial in the New England Journal of Medicine argued that some testing capacity and personal protective equipment during pandemics must be used to monitor the extent of the disease, particularly if there are indications that there are asymptomatic carriers of the virus in the population, which is clearly the case for COVID-19. But understandably, Health Sciences North did not want to make any research commitments during the pandemic, as frontline workers needed the personal protective equipment, and there were insufficient worldwide testing reagents for COVID-19. So we grappled with this dilemma and came up with the following solution. Firstly, we could apply for external research funding rather than burden our local hospital to use its local resources. And we have done so and hope to secure funding very shortly for this study. We also discovered that highly specific and sensitive research-only COVID-19 tests were available for the surveillance program. But these tests are not warranted like clinical tests for use to diagnose patients. These research-only tests would allow highly skilled laboratory researchers who are not licensed to perform clinical diagnostic testing to contribute to COVID-19 research. So we had agreed before the beginning of the surveillance program that we'd evaluate the performance of these research-only tests to ensure that they correctly identified COVID-19 positive and COVID-19 negative patients diagnosed using the clinical test. But then I queried our local health unit to determine whether the research-only test would be sufficient to trigger self-isolation, contact tracing, and contact testing using the research-only test. And the answer became very clear. No, this was only a research-only test. But Dr. Sutcliffe came up with a creative solution to this problem to link the research study to the clinical management of patients. She suggested that if the research-only test performed well with the desired sensitivity and specificity, a positive research test would be sufficient for the health unit to contact the person for testing positive and encourage them to have the clinical test performed. And if that clinical test proved positive, then the clinical test would trigger self-isolation, contact tracing, and the interventions that I described earlier. So I just wanted to use this as an example of how our thinking evolved to illustrate how it's possible to utilize highly trained non-clinical research staff to contribute to important and necessary studies to minimize the effects of an ongoing pandemic and to also minimize the competition for resources between healthcare providers and researchers. I hope that you have found this personal example informative of the impact that COVID-19 and other pandemics can have on research programs and how we might best address these impacts. Research and healthcare are both vitally important activities in a pandemic. With some creative thinking, both can occur simultaneously. In fact, it's research that will often provide the solutions necessary to end the pandemic and its effects, and the tragic loss of many lives across the age spectrum. So if you have any questions or comments of the issues that I've raised, don't hesitate to ask me or a member of the panel. And a final comment is, let's keep the COVID-19 incidence as low as possible in Sudbury. Please wear a mask every time you leave your home and practice social distancing. Wash your hands thoroughly with soap and water on a regular basis, and stay safe. Thanks for listening today.
Dr. Parisinti, thank you for those words. Thank you for that final message. I think this is a message that we're really struggling to get out to the community now as people get tired and we're all feeling the grind of the pandemic. It is super important to stay diligent and keep this pandemic contained. Let me also echo what you just said about the questions and encourage the public to submit questions to the comment section. We have a few questions coming in now, and we will address those at the end. Amedeo, I was really impressed with the way that you're talking about the partnerships that are involved there and the balancing. And it's a huge issue. How do we balance these resources? And it's really important as we're fighting this pandemic to keep in mind that we really need to be thinking about how do we deal with the next pandemic. And I think that your research is directly speaking to that. Our next speaker this morning is Dr. Suzanne Lumo. She is the lead manager of research, evaluation, and knowledge exchange at Public Health Sudbury and Districts. She's also an adjunct professor at the School of Social Work at Laurentian University. She's a keen interest in applied public health research in areas of health equity, opioids and injection drug use, Indigenous engagement, poverty and homelessness, and most recently, as with many of us, the impacts of COVID-19. Dr. Lumo, if you would give us your thoughts, please.
Thank you, Thomas. Ani, bonjour, and hello on behalf of all of my colleagues at Public Health Sudbury and Districts. I'm grateful to be a part of such an important and relevant conversation today. I will be sharing with you the effects of the pandemic on our Public Health Sudbury and Districts agency, the effects of the pandemic on Sudbury and District communities, and future public health areas of focus. As it relates to the effects of the pandemic on our agency, it's important to situate that our work in public health is guided by the Ontario Public Health Standards. One of those foundational standards includes emergency preparedness of new and emerging events such as COVID-19. As our agency is laser focused on COVID-19 response, it is very important for us to not lose sight of other pressing community needs. The pandemic response has meant many changes for our agency. So we have redeployed over half of all of our staff members to COVID-19. We have focused on critical services to meet urgent and time-sensitive needs and adopted extra screening, virtual programming, and physical distancing processes for our staff. Now, how has the pandemic affected Sudbury and District communities? So we operate within the traditional lands of the Robinson-Huron Treaty and Treaty 9 and recognize Wikwemekong, which remains unceded. Our service area includes Greater Sudbury, Espanola area, Sudbury East area, Chapleau area, and Manitoulin Island. So as of yesterday, among residents of Public Health Sudbury and District service area, there have been 67 confirmed cases of COVID-19. 64 are resolved and 2 sadly deceased. To better understand the behaviors related to COVID-19 and the impacts of the pandemic on Sudbury and District communities, we are conducting a series of online community surveys. Our first survey revealed the primary source of COVID-19 information was reported as news outlets such as local, national, and international sources. Regular hand washing to reduce the risk of exposure to COVID-19 was the most reported precaution taken by participants. And the primary sentiment from participants was the feeling of having supportive family and or friends. The impact of COVID-19 on mental health or the health of others in the same household was identified as a primary concern. We currently have a survey that's open right now on safe behaviors, and I encourage folks listening in to visit our Facebook page, at Sudbury Public Health, and to respond to our survey, and as well as to keep an eye for an upcoming survey which will further unpack mental health. So in addition, we also know that the pandemic is disproportionately affecting those that are already disadvantaged. It has opened an even wider divide, placing those typically at greater risk of severe morbidity and mortality. The pandemic has resulted in increased loss in job, increased food insecurity, decreased access to in-person healthcare, and increased reports of poor mental health and substance use. And so now what? What does the future public health areas of focus in the short term look like? So public health planning has been underway to identify key areas of focus beyond the first wave, while we continue to actively respond to COVID-19. Within the current context, 2 areas of focus for program planning were identified: understanding and planning for the repercussions of relaxed public health measures, and mitigating the health impacts associated with COVID response. A number of drivers for decision-making were considered for establishing key areas of focus, which includes evidence. Our colleagues talked about the value of research. So understanding what is the best way, what are the best practices, and what is the research evidence telling us about COVID and other related impacts. Community need and contextual evidence. So what is our community needs? What are those population health indicators that will help inform where we need to focus our efforts? And following this, the areas of focus were assessed based on a risk management approach. So the likelihood that the impact will occur if work is not done, and the impact to health of the community and community members if the work is not done. So some above and beyond COVID-19, some key areas of focus that were identified were public mental health, domestic violence, suicide prevention, senior strategy, family health, resilient schools, substance use and harm reduction, emergency preparedness and response, control of infectious disease, immunization, inspection and enforcement related to food safety and others, and as well, very important to take a look at health equity within all of this. So taking a look at racial equity, Indigenous engagement, and poverty advocacy. So next steps include continue to monitor population health, monitor community needs, plan for future waves, and evaluate our response, and adjust our course of action accordingly. So my parting words are that we all have a role to play to protect ourselves and others from COVID-19. Amedeo, you spoke of those public health measures that are very important to continue to practice as this virus is still prevalent within our community. Particular attention should be given to health equity. Health inequities are socially produced, are systematic, avoidable, unfair, and unjust. The good news is that because they are socially produced, we can do something about it. In the spirit of collectively all playing a role, addressing these pressing challenges and leveraging our many strengths requires us to come together. One such example is the development of the Northern Ontario Health Equity Strategy, which was done with many partners that are on this panel, including NOSM and Laurentian University, which underscores 4 principal foundations: addressing the social determinants of health, equitable access to high quality and appropriate healthcare services, Indigenous healing, health and well-being, evidence availability for equity decision-making. To echo some of what previous panelists have mentioned. So might we move this strategy one step further? So an invitation to all to move the strategy and apply some of its principles. We have what it takes locally to come up with creative solutions to complex problems. And, the evidence is everywhere in our community. One that I would like to underscore is Science North is developing virtual education resources for all Ontario schools. This is excellent, and I would like to say thanks for everyone for doing such fantastic work. And together, I know we can find solutions and make a difference. Merci. Thank you. Miigwech.
Dr. Amedeo, thank you very much for your words and your perspective on this pandemic. I really appreciate the comments that you've made about the disproportionate effect of this pandemic across our society. And I think it's underscoring things that we already knew were there, but we were doing a better job of ignoring. And this pandemic has forced us to say, you really can't ignore these things. And we're moving forward, hopefully, with a better view of what it means across our community. I know this is certainly something that we've spent a lot of time talking with our daughter about. What does the pandemic really mean to the society as a whole, not just to our household? So thank you very much for that perspective. That's wonderful. Our last speaker for this morning is Dr. Greg Ross. And again, before I introduce Dr. Ross, let me thank the three panelists that preceded us, him, and ask everybody for questions. We're going to move to the questions session after Dr. Ross, and I'm sure we'll have questions for each person. Dr. Ross is a professor at the Northern Ontario School of Medicine, where he's a vice president, academics and research, also at Health Sciences North, and he leads all activities at HSNRI. With that role of leading all activities, Dr. Ross, if you could give us your perspective of the pandemic and what this pandemic means going forward.
Great. Thanks very much, Thomas. It's wonderful to be with you. I appreciate the opportunity. First of all, it's great to be part of these and listen to the other perspectives of the other panelists. So thank you for so much of that. And I want to build on a few of those comments. First of all, Suzanne talked about the health crisis and what a challenge that is for our healthcare systems right around the world, including our local healthcare systems. So just to remind everybody, the numbers where we are today, there's been over 8,000 deaths in Canada, over 2,600 in the province. And Suzanne talked about some of the numbers locally here. So it has undebatably been a health crisis of proportion that we really haven't seen. Amedeo spoke about the economic crisis that this has really represented. A lot of people have lost a lot of savings, and a lot of people are really suffering. Those who are out of work as a result of this pandemic, for example, such a tragedy. That's personally. Of course, nationally, the CBC reported just the other day that the COVID-19 pandemic has cost the federal government of Canada approximately $1 trillion. And to remind everybody what that number would represent, $1 trillion is more than our national debt prior to the pandemic. So this has really been an economic situation that is truly out of control. So there's going to be really, really important implications to that moving forward. Amedeo spoke to the reality, which is, research the innovation agenda has limited support, and there's finite budgets for this activity. So there's going to be a lot of implications. But to balance that, I think the other thing that the pandemic has clearly illustrated is a tremendous data crisis. And I want to remind everybody that when we were talking about COVID at the beginning of this pandemic, nobody knew for sure if it was droplet precautions or it was spread in the air. Nobody knew for sure how long the virus lasted. Lots and lots of very fundamental, basic questions about disease spread, incidence, prevalence. And I really do, as I said, suggest that it represents and still represents a data crisis. And because of that data crisis, I think there's going to be profound implications and will change the research and innovation agenda moving forward. One of the things that I found remarkable is right now, science is the star. If you turn on the news, you're likely to hear a politician talking about incidents, for example, of the disease, and they're putting graphs up. People that would never have presented graphs before in their lives are all of a sudden presenting all kinds of data. It's really interesting to see, and I think it beautifully illustrates in many instances the need for better science communications we have in our society. And what I think it's really done is obviously focused a lot of activities of a lot of people onto how we might address some of these programs. And I believe personally that overriding that is a focus on digital health. We've seen digital health emerging for lots of years now, probably 10 or 20 is kind of the concept. But I think this really represents the end of the beginning of digital health and really moving into an absolute digital health focus and to start to deliver on the opportunities that digital health provides. So, for example, in the province of Ontario, there's major investment announced in an integrated health data platform. This will enable programs such as ICES North through the clinical evaluative sciences programs to really start to use healthcare data in meaningful ways to assist public health, to assist politicians, to assist the healthcare system, to really make decisions moving forward that are informed, and there's the data to support that. So again, as was mentioned by Suzanne and Amedeo, the diseases that we're currently faced with aren't going away. Cardiovascular disease has not gone away, cancer, dementia, respiratory disease, the leading causes of death globally as well as in Ontario really aren't going to change, and those aren't going to continue. I think there's probably going to be, again, a lot of interest in that because I think just with the interest in science right now and what the power of data can do is going to be really important, and I believe that research will continue. I think that there's going to be changes to how research is done, but that's going to be much along the lines of what Mary Catherine was talking about with changes of education. So education is going to continue, but we all know that it's going to, the pandemic will force huge changes in delivery of that education and innovation within the education systems. And I think in the research space, we're going to see the same sorts of changes. So maybe a couple of predictions, and I'm always nervous about making predictions because in my career, I've always noticed that most of them were wrong. But anyway, I'll make a couple of predictions. And that is because of the excitement right now for science and the recognition of what research can provide. I think the need for research will always be supported and continue to be supported as a result of these activities. I think everybody sees the value in doing the work that provides the information that people require to try to tackle the issues that Suzanne, for example, was referring to. I also think there's going to be a profound communication need. So many of even the panelists have recognized for years, Science North plays such an important role in communicating science to the public. And I think that need has been just so nicely illustrated with the current issues that we have, and really is going to be important moving forward. So in summary, I don't believe that the basic sciences that we are good at here in Sudbury and that we're good at in Canada, things like immunology research, cell biology, things like healthy aging, a lot of research programs that are going on that have a lot of impact on people's lives, cardiovascular, cancer, you name it. I think that will continue. It'll always be competitive and there will be pressures, of course, for the resources, but it's necessary. What we look at, though, as, say, research administrators, or I would look at if I was just starting out my career and opportunities moving forward, is what are the areas where there's going to be expansion? And I personally believe that the expansion in healthcare research, healthcare opportunities, facilities we should be thinking about investing in, really result from things like digital health. How can we take the data that we are acquiring and apply it using tools like administrative data approaches to really improve public health? So if I was thinking again as a young person starting out a career, I'd be looking at digital health and administrative databases. I'd be looking at things like public health and science communications as areas where I think the COVID-19 pandemic has absolutely drawn into focus where we should be really applying our attention. So those were my only comments. Thomas, I'll hand it back to you. Thank you.
Thank you, Greg. And I'm going to welcome all of our panelists back as we go and transition into our quick Q&A session. Thank you, all four of you. Greg, don't turn your camera off. Turn it back on. There you go. Those were four really uniquely different perspectives, and I've made a series of notes, some of which I can actually read. Amedeo and Mary Catherine, if you would join us as well. I want to go through and try to get us as a group to address some of these points. And maybe as a starting point, Greg, you made a really interesting comment about science being star right now. And as a research scientist who's spending a year as a scientist in residence at Science North, this resonates with me. This is something that I'm really interested in. But I think it also speaks to or leads to a conversation, interesting conversation about what science as a star means across our society. And I wondered maybe, Suzanne, if we could start with you, if you've got a perspective on this. But information is such a big deal right now, and everybody is so unsure about what's going on. Even the experts, we just don't know what's coming next. We are in seriously unprecedented times. So what does this idea of information and this key role of science mean across our society, not just to an individual household? So Suzanne, do you have a perspective that you could share on that?
Sure. I think it's important that we pay attention to multiple sources of evidence. So certainly population health information, community and local context, so what is happening, political context as well as working within your resources and capacity and with the partnerships that you have. So I think in all gathering of evidence, it's important to look at these different types of evidence, to lean on research evidence for best practices, etc. So there are multiple sources of evidence that we need to weave together in order to understand this problem and in order to effectively respond to it.
But do you think that different parts of our society are going to be responding to that differently? I mean, how do we deal with the fact that we've got the sort of inequities in education? I mean, when you're trying to explain fundamentals of why we should be wearing a mask right now, you can't make the same argument with everybody because everybody's coming at it with a different perspective.
And I think that's that knowledge translation piece that's really key. And so how do we transfer evidence into action? And so, Greg, you mentioned, the value of science communication and how we transfer that using social marketing strategies. So it's one thing to collect the information to help inform how we do business and how we might inform, the move forward for example, in public health. But if you can't make that liaison between the evidence and the action piece, then it's a pen perdu. It's a waste of time. So it's really important to ensure that we translate that evidence into practice, that we find unique strategies that will hit home for folks and for agencies to be able to promote and to be able to practice these, right now, public health measures, for example.
Mary Catherine, I was wondering if you could give us your perspective. I mean, you've spent so much time thinking about how we communicate these things. I mean, just changes in our education system. So how does this idea of science being a star right now, how do we take advantage of what we're learning in different ways of digital or different digital strategies to try to work with the public to explain what we're dealing with?
So thanks for the opportunity. I was actually, it's funny that you say that, because when I was listening to Amedeo speak about research, I realized it was very enlightening, because I know that in the medical community, we often breathe a sigh of relief when we have something from research to go on. Like, okay, here's a medication to try, here's a new strategy to try, here's a preventative strategy. And in a way, I didn't think of the opportunity for us to share with you, so that you might be using PPE, you might be using the same reagents or tests. And I think that COVID-19 is highlighting a lot of heroes that we didn't often hear about. So, I have a family that does research background and things too. I don't think research is always highlighted as much as it could be. I know public health are the unsung heroes that, didn't realize that they'd have this giant opportunity and to be in the limelight. So I think we're bringing to the forefront a lot of important people have been doing important work and kind of highlighting that. I think it's important for us to translate a lot of this to the community as well, to explain why we're doing some of these measures like social distancing or, wearing a mask in public. And I think it's also important to know that each of us has a role to play in treating this pandemic, because by the time you get so sick that you're in the ICU or you're in the hospital, then we rely on the limited things we can do to try to improve your health. Whereas there's so much upfront that we can do to try to prevent it. And so we talk about, everyone trying to pitch in to do those measures.
That's fantastic. Thank you. I really appreciate that perspective. Amedeo, you have spent a lot of time in the 15 years that I've known you working at the edge between health research and the public. So the work that you've done with investigating chemotherapy and the effectiveness in chemotherapy, you're now at a point where we've gone from looking at this long-term issue where cancer is such a huge issue in our society to this immediate effect. that we've got a pandemic. How are we going to deal with that? As an active researcher, how do you talk to people about those trade-offs? So, this idea of resources going here, resources going there. When I go into the lab to maintain stocks in my lab, those are resources that could be going somewhere else. So when you're talking to people about the value of your work, you're in the perspective of having done this for a long time. What can you tell us about explaining to the public the importance of that fundamental research?
It's a real challenge when you have limited resources. And I'm really sympathetic to frontline healthcare workers as well that are making painful decisions. When you have limited resources, how do you dispatch those resources in the most effective manner? And that's why I raised the issue of treatment is so important to existing patients. But if we all have this view that treatment trumps research, we'd still be complaining about the budgets for leeches and that they weren't high enough to allow us to do bloodletting to continue to cure disease. So this is a regular battle between research being supposedly seen as a luxury and how research is actually the conduit to solutions. And I echo Greg's comments as well that one of the things that the pandemic has done is it has underscored how accurate scientific information is key, and no spinning, no wishful thinking is going to change that view. You have to, in order to deal with this pandemic, you have to find creative ways of utilizing the resources that are possible. And so that's why the one example I gave of research specific tools that are not at the level that can be used to diagnose clinically can still be very effective in advancing our understanding of the virus, but not competing directly with the same reagents that are being used. So I think the challenge is look at the resources and remember that research is an important component of hopefully eliminating or at least reducing subsequent waves of the pandemic.
Yeah, and so I want to sort of
communication as well. Yeah.
So I want to actually, communication is what I want to talk about, and I want to come back to this idea of allocating resources. And Greg, I'd like you to talk about how you allocate resources across an entire institute. But Amedeo, the point that you made right before that is the importance of good communication. And so honestly, as a researcher, I do feel like that people often think of research as a luxury. This is something that we do when we can afford to do it, as opposed to this is something that we have to do so that we can actually battle these pandemics and we have a chance of surviving these. I mean, if you look at the way that society responded medically, the tools that we had to the 1918 plague, the Spanish flu versus the way that we're responding now, we're in a different world because of the money that was invested in research. But right now, possibly more than ever in history, communicating this research is so incredibly important, and good science communication. So I think we often look at science communication in this way of, it's a way that we engage kids in science and we build up the next generation of scientists. And 100% that's important. But even more important is how do we educate the public the importance of what we're doing? And how do we get this message across in a way that everybody can understand? And I think this is one of our huge challenges, is it can't always be the same message. So the important points are still the same. Wear a mask, wash your hands, stay socially isolated, be diligent. But you've got to pitch that in different ways to different people to get everybody's attention. And I wonder if anybody has any other perspective on this importance of science communication and really good, intelligent, informed, trained science communication. Okay, that's my science communication soapbox, and I will step down from that and say that we need more science communicators the same way that we need more researchers, and we need really good trained science communication. Greg, you've got an institute that you have to not budget, but you've got it to allocate. So I'm an active researcher at the university. I have to convince the university that they should allow me to have access to my lab to maintain fly lines, right? And so I have to pitch to them the importance of a bunch of vials of Drosophila melanogaster. And then they've got to take my pitch and they've got to weigh it against all the other researchers at the university and say, this is how we're going to allocate the resources that are there. This is part of your job. How do you make that allocation? How do you talk to different researchers and say, I know that your work is the most important thing in the world, but you can't get into the lab until next week?
Exactly. Yeah, that's that's absolutely true, Thomas. And it's a lot of it's a lot of wishful thinking. I think that term came up early. We like to think that we can make the best investments we can, and there are some things we can't consider when making those investments. One of the things we always focus on is really the potential impact of research. I want to come back to science communications, if you don't mind. The current situation has really brought to the forefront, in my opinion, the absolute need for communications, how critical it is, and yet with COVID, everybody has now context. So one of the challenges of any communication strategy is, people are kind of wondering, why does this matter to me, and what does this have to do with me? And of course, in the current situation, it has a lot to do with every single person in our society. And it's kind of fun, right? Like every single person in our society is now talking about, antibodies and antigens and how long it takes to do a clinical trial and how long it takes, to bring a new immunotherapy to market. These are discussions that never would have happened, among the public only a few months ago. So I think this is really an opportunity now, what exists. And it's not just there's the opportunity for science communication, there's an absolute critical need for science communication right now to take the people who understand and know some of these things and diffuse that into the public. And it's a perfect opportunity because the context is there for the public. The average person wants to know more all of a sudden about virology, who had absolutely no interest in it a couple of months ago. So I really do think it's just a convergence of events which really highlight the incredible need for some of these activities like communication and technical science communications. I think that's what's really come out of this.
So the other aspect of that, I think that we're hopefully pursuing, is we need to understand how that science communication is impacting the public. So Amedeo, to your point earlier about needing better testing to understand how the virus is spreading, because it's going to inform how we're dealing with the pandemic now and how we deal with the next pandemic. I think we need to understand how the public is responding to the messages that are out there. So when the president of the United States tells people to inject bleach into their veins, how is that being accepted? How is that, apparently pretty obvious misconception being addressed in the media, and how are people responding to that, so that we have an understanding of how you talk to people about the important points that are out there. And Mary Catherine, I wonder if we could come back to your idea of your expertise in these virtual classroom and these simulations. As we're looking at how we're going to deal with medical practice, with health practice in the North, in Ontario, in Canada, and globally, how are the things that you are learning in the classroom going to influence Greg's comment earlier about digital health and that transition to much more virtual world? What are we learning in the classroom that we can apply into the broader health field?
Great. So a few comments about that. One is just to comment on the previous conversation you were having about science communication. I think we mirror that in healthcare. So we recognize that, if we tell someone, take this drug, take your insulin, do these things because we told you and we know it's good for you, the buy-in is not as big as when we say, this is why. Let me explain to you exactly the process is happening. This is why you're having this surgery. This is why, controlling your blood pressure, although you don't have symptoms, will prevent you from having a stroke, etc. So we find that putting it in language that people understand really helps with buy-in. And I think similarly, people are very interested, as we said, in science now, and explaining at a level that people can understand in a very community forum, very much like this one, will be super helpful in helping move that kind of education forward. From a digital standpoint, I think what we're looking at is taking some of the learning that we're doing, sometimes in bigger centers where there's some more specialized care, and then trying to spread that throughout the region. And so what we talk about is we can do these kind of high fidelity learning scenarios, but what we'd want to do is, right now, people can't travel from all parts of Northern Ontario to Sudbury, for example, to run these courses. And so how can we adapt and change those things? So we talk about stay in your home community, have you simulate an event or some kind of learning opportunity, and let's have people tune in and watch you and supervise from afar and give some advice and feedback, kind of an overview from what we see where we stand. And so we were talking about this could be, relate to critical care practices. It could be for all kinds of specialty practices. It could be for primary care. Currently, we have a very strong virtual critical care network that some of our physicians put together, and we could expand this, I think, in the future into other areas as well.
Yeah, that's a really great point. And that this idea of expansion is, I think, something that we're all exploring. I mean, the number of households that we're reaching right now with this seminar or webinar is different than it would have been, if we didn't have these digital platforms to reach out. Suzanne, you've got a perspective that you were going to share with us.
Yeah, so someone commented earlier about evaluation, and I think it's important that we document what is working well with our response currently, what is not working well, and areas of future improvements. And I think that there could be a more, efficient way of doing so. So we're doing it for our local public health, but there may be a value add in doing it at the provincial level. So we're all collecting the same type of indicators, and we're all, responding and course correcting based on evaluation data. So I just wanted to echo some of the comments that you had made earlier about evaluating the pandemic and our response, and a way to be able to course correct. There's currently a network, the Ontario Public Health Evaluators Network, that is brainstorming and sharing resources around evaluation, which has been extremely helpful to do in collaboration with other public health units and as well as Public Health Ontario.
That's a really great point. I mean, a number of really great points. One of the things that maybe we could address as a panel is this idea of changing course. So as we have learned more about the pandemic, we have had to change the message that goes out there. And I think the masks are a really great example of that, where early on there was some question as how effective will masking be? And I think there's still a lot of stuff floating around on the internet saying, masks are not helpful, right? They're actually going to be promoting reinfection, I think, is one of the themes that goes out there. So I wonder if any of the panelists can talk to this idea of how do we incorporate new knowledge, and then how do we communicate to the public the fact that the best practices are going to change through time. I think that this is, as a scientist, this is one of the hardest things to pitch to the public, is that we really don't know everything. And so we do change course because as we get more information, we've had to reevaluate. And, does anybody have examples of things? And so I think, Mary Catherine, maybe you can start, and then Amedeo will go to you.
Sure. So we noticed this in our educational rollout, is that there can be some feeling from the frontline workers, for example, when you're rolling things out, if you're constantly changing the message you had. So today we'll wear this type of mask, tomorrow we'll wear an N95, the next day we'll change again because public health has some new recommendations. Typically, I know myself, I'd be thinking, who's making these protocols and why can't they make up their mind? But what we have to realize, we've been trying to really stress with people, is that information is constantly changing. This is a pandemic. We've never faced this before. We have to be reactive. We have to adapt to information that's coming. And that's a good thing. It's not a bad thing, but we have to change that mindset. So you're going to expect that in the next day, things may change, but that's to protect you and the public. And so we don't want to look at it as people not knowing what they're doing. We really want to focus on the fact that people are responsive and they're sacrificing their own reputation as they make these new recommendations to keep us safe as a community. So I think that's a really important message as we teach.
Yeah, that's a really important message. Amedeo?
What I was going to add to this part of the discussion is that the public is just starting to recognize the difference between information and peer-reviewed information, and that there's a big difference between the two. A lot of the public doesn't understand that most of the findings from studies have to undergo a process of peer review. They've never heard of the concept. And don't understand that it is that rigorous peer review that allows you to discern between what is likely valuable information that's likely valid and others that might be good ideas but still suspect, etc. So I think, trying to relate again to what Mary Catherine was just saying, that there's a lot of information out there. And we are looking at the peer-reviewed literature, and it's only through the peer-reviewed literature, through well-set-up studies, that we can make a definitive conclusion whether a mask is of value or not. And even some questions about whether, if a person has antibodies to COVID-19, can they be reinfected, and these type of things. Without rigorous, well-controlled trials in multiple populations, it's hard to know. And at the same time, that takes time. So the public has to understand that rigorous studies take time for peer review, but in the end, we all benefit from that rigor than simply just whatever we feel is best at the time.
Yeah, I mean, that's a really great point, Amedeo. And actually, there was a piece on CBC this morning where they were talking about the speed at which we're going to be looking at a possible vaccine. And the discussion was really around, how do you set up a scientific trial? And Greg, I think this goes back to the point that you made earlier, that we're in a very different world where you're going to have a discussion on the morning news about experimental design. And so this idea of peer review, the idea that you produce a study, you write the study up, it goes out to a set of other scientists who then evaluate that work and decide whether it's been done in a credible fashion, and then goes back out. It's really difficult to do that, or at least we're brought up in doing that in a different time frame than we are responding to a pandemic right now. But that information is different when it has gone through that review process, when independent review of the work to see whether it really is well-founded. And we've already seen some very high-profile studies that have been retracted because perhaps they weren't done as well as they should have been, because the emphasis was on quickly getting that information out, not making sure that the information was really correct. But when we're looking at something like a vaccine that we could potentially be administering to every person on the planet, that has to be done in a very rigorous, it has to be developed in a very rigorous fashion, in such a way that we're not causing more harm than good. And that requires taking the time for really well designed experiments that are reviewed by peers in this peer review process. All right, we've had a question from our audience. Tiffany Moran asked the question that I think everybody is asking at least at some level. Is COVID-19 almost done? And I think more broadly, we could think about just, where are we in this pandemic? And Suzanne, you had offered to take the first stab at that.
Yeah, so when I think about this, I still think about, it's the virus is still active within our community. There is still a risk. And so we need to practice the measures, as you've mentioned, Amedeo, so graciously. Wash your hands frequently. Stay 2 meters away from others. When that's not possible, wear a mask. You can get a whole list of ideas on how to practice physical and social distancing on Public Health Sudbury District's websites, and I'm sure on all of your collective websites. These are important. We need to continue to be vigilant because there is still the spread of disease within our community.
Yeah, that's great. Would anybody else like to chime in on that? Sure.
One just has to look at what's happening in the southern United States to recognize they flattened the curve for a bit, and then all of a sudden the virus is taking off as people start to normalize activities. So again, stressing what Suzanne has just mentioned, that unless we take this very seriously, we cannot return to our previous lives in any stretch or form. Possibly even once a vaccine is available, because it's going to take time to assess the efficacy of the vaccine, et cetera. So some people, for example, don't recognize that even that 2 meter distance, there's evidence in the peer-reviewed literature that the virus can transmit beyond 2 meters. So there's no peer-reviewed literature that suggests that 2 meters is effective. That was the best guess at the time. That's where masks, in addition to the 2 meters, provides that additional protection. So the pandemic is far from over. And I think in Sudbury, we've already seen a few more cases from travel. And in one case, we're not sure. It might be just a local transmission. The virus is still here. And that's why I can't stress enough the importance of surveillance. And the big fear I have is that as there are less and less symptomatic cases, we may all start to relax and go, and some people in Sudbury are already kind of doing that. The virus is gone. No, it isn't. I'd be very surprised if the virus has gone completely from Sudbury. And now we know we have additional symptomatic cases. But without a legitimate randomized population surveillance, we really don't know what the incidence of the virus is. And I think that's critical information to help us move forward.
That's great. Thank you. Mary Catherine, you said you had a perspective to add to that.
Yes, I think it's, I echo what Amedeo was saying, that it's still important to be vigilant. We'd be foolish to think it's gone. We wonder if we're going to get another big wave or it's going to trickle in slowly, and we don't know. But I kind of liken this to treating something like hypertension where people don't necessarily have symptoms. So what we often say is people get on their blood pressure medication. I can talk about my father-in-law a moment, but he'll be on his blood pressure medications and he says, my blood pressure is good. I probably don't need it anymore. I wonder if I should just stop it. Well, is your blood pressure good because you're on these blood pressure medication, or because we're doing social distancing practices? Is that why Sudbury's done so well? Or is it really that the virus is gone? And so I think whenever you do things well and we do social distancing well, there's always a fear of saying we must have overreacted. But I think in this case, Sudbury, I'm very proud of our community. I think everyone's done these social distancing practices very well. And as our fear lessens, I hope we don't forget the important things that we're doing and stop and have these resurgences happen. So I think it's still really important to continue to maintain those things.
Yeah, those are really great points. And I remember early on in the pandemic, health officials coming out and saying, if we do this correctly, people will think we overreacted. And that's the sign of success, is that it looks like an overreaction. And unfortunately, the sign of a failure is that we get a second wave. The blood pressure medication is perfect. That's what killed my grandfather. He felt fine, so he didn't take his heart medications. And this is really, it's a great conversation. There have been a couple of points that have coming up that are questions from the audience. One of the points I thought we might come back to was something that, Greg, you had brought up about as we're looking at moving forward from where we are now, possible changes in career paths. So what are we seeing? We talked about changes in the way that we're talking about the pandemic. We've changed in the way that we're allocating resources across our community, the way that we're trying to deal with inequity in our community. I wonder if we could get some thoughts on what we can say about possible changes in what we're thinking about careers going forward, following or in the middle of, and then at some point following the pandemic. So, Greg, would you like to come back to that and start us off on that?
Sure, I'll start us off on it. Thanks, Thomas. One of the things that strikes me, and I think all of us in Sudbury should be amazingly proud of this. We have outstanding educational institutions in the university, colleges, medical school. We've got fantastic integration with groups like Health Science North, where many of those learners will end up. And we've got fantastic integration with things like graduate programs. So, any one of the panel could speak to the amazing graduate programs we have that would be relevant in public health, new Masters in Medical Education at the Northern Ontario School of Medicine, the graduate programs in cell biology at Laurentian University that are world-class, fantastic research going on at the colleges. And all of that, in my opinion, kind of contributes to the key word now would be an ecosphere, a health science ecosphere that we have in Sudbury. And right from, early training programs right through to creating those professionals that can staff our institutions who understand these things. We've got homegrown kits here for doing testing. We've got laboratories set up locally from people that work here. And our learners are participating in that. Our graduate students, undergraduate students, interns from the colleges, you name it. They've all got a crack at participating in that research. And I think that's something that here in Greater Sudbury, we should be unbelievably proud of, because that's having huge impact in Northern Ontario.
Yeah, and going back to our point earlier about science communication, Laurentian University has a master's program in science communication. It's the only master's program in North America. And so it's producing a lot of the people that have that responsibility of going back out and talking to the public in such a way that the message is getting across correctly. Suzanne, you've got something to add.
So, Greg, I think what you just said is fantastic. We have everything at our fingertips locally here, and I think where we might want to expand will be in our ways of doing. So, in our ways of communicating, to your point, Thomas, and our ways of virtualizing in technology, and our ways of being able to do collaborative research, to apply that research, but it's in that it's in finding the right technologies and ways of in this new way of in this new normal, I suppose.
Yeah, that's great. Mary Catherine, does this talk to the developments that you're making in the classroom, the new ways that we're doing this? I mean, a lot of the education things that at least I've been part of as a professor are sort of stopgap measures. You know, what are we going to do this semester? Possibly, what are we going to do this semester after that? But I think there's the part of that is honestly slightly panic driven. Like, okay, we've got to be ready in September, or we're going to close the doors, right? But there's got to be a better conversation going forward with not only what are we going to do in September, but what are we going to do in January, and what are we going to do in May, and what are we going to do next September? And I think maybe that's the kind of things that you're thinking about with the simulation labs.
No, you're absolutely right. And I think sometimes the way we approach it is trying to do a needs assessment. So sometimes what we do is, as the educators, we try to think of what we should teach you. And so that's really important because we have some experience and skills and we may know what other people need to learn. But sometimes we don't recognize what learning points are out there in the community or in other areas. And so we often try to approach them for a needs assessment. Like, what are the top 3 things you want to know about? What brings you the most fear? What do you feel like you need to learn the most about? And it can kind of inform our content. And then we find we get a lot more buy-in because it's actually something very relevant to what people want to learn, which is always helpful. We have to be really open to feedback. So when you ask people, for feedback like that, you can't be shut down or insulted if it's not exactly what you think people want to know. And so you have to be really willing to hear that and adapt your curriculum to teach that. What I find really novel about COVID-19 is that we're starting to form alliances like this one, where, we're talking to people who are doing research, and then we're talking to people who are doing education innovation, and we're talking to people about, I didn't know much about learning systems and educational models prior to this. It's really not my background. I'm very clinically based. And so, it was very interesting to see we're doing these things. Someone can name them and talk about how we could do research into those areas and try to amalgamate some of these learning opportunities.
Okay, that's great. Maybe that's something that we could talk about next is these interesting collaborations that have come out of the pandemic. I wanted to get to one point that came from actually my fellow scientist in residence at Science North. He taking us back to the idea of masks, no mask. It's a really great opportunity to talk to the public about how we do science. So we should all be wearing a mask now when we're interacting in the public. And when people say to us, okay, but we were told not to wear a mask. Well, that's an opportunity to talk about how our approach to things changes with new information. And we're trying to do the best that we can from an informed perspective. And the informed perspective is the important point there, because what as information changes, as our understanding, the information doesn't change, but as our understanding changes, we're going to have a different approach as we hopefully understand more about what's going on around us. All right, can we talk about collaborations? So I think that in the few months that we've been doing this, we have all have experience with a unexpected collaboration. Where are we finding a source of inspiration, a source of knowledge that we would not have expected on March 11th, right? Did we lock down on March 13th? Something like that. It's interesting to be at a point where we could actually say that there is such a change between one day and the next. So I have a collaboration. We've got a grant in now under review with a scientist at HSNRI to use sequencing techniques that he and I have talked about using in different contexts, but possibly using now as a way to look for other ways to monitor the pandemic. And so I hadn't really thought of using these techniques in this way, but the researcher, Dr. Ibizeta, contacted me and said, here's the stuff that we've been doing, and we've been using this sequencing technology to ask these questions. Couldn't we use this same technology? And in fact, it wasn't couldn't we? It was, here is a way that we could use this technology to potentially monitor the spread of the virus in our population. And that was not how we expected to be using that technology 2.5 months ago. So does anybody else have examples that they'd like to share about ways that they're finding unexpected inspiration or collaboration during the pandemic? Greg.
Sure. You know, one of the things that I've been surprised by, Thomas, and it's been really really helpful for my thinking, and I suspect a lot of other people. Science is getting so broad that it's incredibly to make high impact, dramatic steps, kind of working alone in the lab, you know, along, and I'm not criticizing that kind of work, sort of curiosity driven research is incredibly valuable and has made, you know, amazing breakthroughs. But yet when we start to take on problems like how do we apply digital health, the expertise you need to ask those questions is incredibly broad. You need amazing computer science infrastructure. You need amazing data, large database expertise to handle that data. You need the healthcare providers who can ask you what your questions should be. And it's that really breadth of the science. And I think COVID-19 in my career, it's been by far the best example of you better get some new folks working together with diverse experience that can collaborate and apply it to a single problem. So, you know, the comments about, you know, university-based researchers working with public health-based researchers, working with hospital-based researchers, because together, I think people recognize that, and Thomas, you brought this point up, the pace that this data is being demanded right now is very, very different than classically the way academic research would work. So if you want to do high impact work and you want to do it quickly, you'd better be working together. And I think it's both an imperative, but it's also an amazing opportunity and really should be the way we do research. So I think it's been very exciting.
Yeah, I completely agree, obviously. Suzanne, you've just piped in to say that you have something to add, but I was really listening to this thinking, isn't this how public health actually has always worked? That academics are notorious for working in our own little silos and, you know, examining the number of hairs on my fruit fly. Whereas I think that, you know, public things like a public health unit are by their very nature collaborative and more interactive. So can you share your perspective, please?
Well, thank you for that comment, Thomas. We try and do our best to work and collaborate with others and to learn. We have a formal agreement with Laurentian University, as does you know, others on the line, and so it's really helped to be able to move research forward, to have that formal collaboration. But I've used three networks very closely throughout this pandemic to help inform how I'm going to evaluate our local response. So I talked about the Ontario Public Health Evaluators Network. We share resources, tools, evaluation plans, all of our surveys or data collection methods, which is amazing because I don't have to reinvent the wheel. So it's being very efficient in the way that we're conducting our evaluations. The other thing is leaning a lot on AFIO, so the Association for Public Health Epidemiologists of Ontario. So there have been a lot of surveys going around in regards to and surveillance questions that have been posed in this platform. And so monitoring that and learning from each other has been very crucial. And I rely a lot on the National Collaborating Center for Methods and Tools, which critically appraise evidence on all of these very important topics, whether it's masking, whether it's post-wave ways of doing post-first wave. So I have continuously monitoring those three networks and learning from others. So it could alleviate some of the pressure off of our local public health unit. We can be more efficient at what we do. So it's really thanks to all those great folks out there, like those of you who are on the line and the work that you're doing, that I feel, you know, strength in being able to do our local public health, knowing that others are moving forward on tools, surveys, research to help inform how we do business.
Yeah, I mean, isn't this one of the things that I think that the pandemic is really driving home, is this cooperation and collaboration? So I'm on the board for our local farmers market, and we closed in the winter immediately following the lockdown, and we were trying to figure out how to reopen. And actually worked very closely with public health to figure out how do we do that in a safe way. But we didn't have to work in isolation. So we were working with Farmers Market Ontario. We were working directly with other farmers markets across Ontario to say, how have you done this? What's working? What hasn't working? What are the things that you're thinking about? I mean, we were all open at about the same time. And so it wasn't necessarily having a chance to say, here's a success or something that we need to change, but here are the questions that we're all asking. And so I think that one of the big positive impacts of this pandemic is because of things like digital technology that we're using here, we're able to cooperate and collaborate and share resources in a way that had been possible, but maybe wasn't something that we were exploring. So we successfully opened the market about 10 days ago, and that success was because of working in collaboration with people across the community, working with the city, working with public health, working with other farmers markets, and then having great buy-in from the public saying this is something that we found important. So can anybody else share any ideas of collaborations or cooperation support that they've seen during the pandemic that maybe they hadn't expected, or things that they had expected but they're actually working, right? Those are also great stories. We thought we were going to be able to do this collaboration, and in fact, we can, which is super. Don't leave me hanging on this. Come on, we got to wrap up strong. All right, Mary Catherine.
No, I think everyone kind of builds on the enthusiasm of other people. And just as a small example, from Health Sciences North, there was talk about when we were first learning how to intubate patients safely with, particles, etc. There was help from Laurentian University and industry to build these plexiglass boxes to try to contain some of those droplet particles and see if that would be safe. But the interesting thing about that was it started with some clinical ideas from some core people, and then Laurentian collaborated and other industry collaborated to try these things out. So I thought that's very interesting that these are collaborations that never normally happen, but in a spirit of everyone wanting to help, people were very willing. And so, it's interesting when you get other people's perspective, how you can come up with some new and fresh ideas and kind of reinvigorate your interest in the research you're doing or the education you're doing already.
Yeah, absolutely. And my favorite unexpected collaboration like that. So my department has actually been supplying hand sanitizer, and the chairman of my department goes in, I think it's every second week, and makes 50 gallons or something of hand sanitizer with the ethanol that we have in stock for scientific labs. And I think that is absolutely lovely. However, my favorite is that my favorite local distillery, Crosscut Distillery, has segued into making hand sanitizer. And Shane, the master distiller there, is just a wonderful human being. He makes a mean gin. I got to tell you, his gin is just outstanding. And he makes an outstanding hand sanitizer. And so, that has been across Canada. I know it's been across the province that these local distillers have really realized that they can make a valuable contribution. And early on, when there was no hand sanitizer to be found, you could get Crosscut hand sanitizer. And my daughter swears it smells like gin. Now, two things. One, I'm not sure how my 10-year-old knows what gin smells like. And two, I'm not sure that Shane would agree that the hand sanitizer smelled like gin. But, it was this idea that we're all in this together. And so people like local distillers would say, here's something that I can contribute. And people like the chairman of the Department of Chemistry and Biochemistry said, here's a way that we can contribute. It is a challenging time. But it has been a wonderful time to see some really wonderful human beings step up and address those challenges. Amedeo, you had a comment.
Yeah, relating these collaborations with communication, one of the things that's critical is during these times where all of a sudden we're trying to establish multidisciplinary collaborations, that communication has to be there beforehand. And in that sense, when I was working with Dr. Sutcliffe and with Dr. McElhaney and Dr. Conlon, those relationships were already there. And it underscores how important it is for our educational institutions, our hospitals, and our businesses, everyone communicating on a regular basis so that we can tap on those networks and that communication to forge these collaborations in the future.
Yeah, that's a really super point. All right, we are wrapping up. We're going to go to Julie in a minute for final words. But are there any final comments across the panel? Things that we've learned so far, things that we're learning about where we're going next. I think that the common theme of collaboration, cooperation, education. A comment that came up from one of the viewers was that this pandemic really is encouraging us to think about how we look at science education. If we go back to Greg's early comment that science is star if people understand what science is and how we get to science and the fact that science changes. If you think that science is not something that changes through time, then the mask situation doesn't make any sense. If you understand that science changes as our understanding changes, then the mask situation makes sense. Suzanne, going to the points that you started us off with, this idea that we have inequity across our society, and part of that is going to come back to, I think, education and understanding. These are issues that we need to be addressing. All right, I think Julie is going to join us in a second. And I want to take an opportunity before I sign off to thank all of the panelists for their contributions today. I certainly have learned an enormous amount, and I appreciate the opportunity to be part of this discussion. Thank you all so much.
Thanks, Thomas.
Thank you so much, Thomas. And I have to tell you that it's just been incredible listening to all of you. And on a personal note, I am so proud of the medical leadership and strength that is just right in our backyard that is keeping us safe. I think we've all seen and learned so much from you today about exactly the strength that we have in our community and across Northern Ontario. So that's been incredible. So thank you so much to everyone who participated today. I have some extra special thank yous to do though, because as I mentioned at the beginning, this was the final of our 6 series with Laurentian University. And I did want to take a minute before people sign off. Can you please do us all a huge favor and drop in the comments section any topics that you might want us to speak to on a future series? We're already building on the success of this one and thinking about what will be our next series. We're thinking about doing another one starting in late August into September. So please take a minute and just drop some ideas into the comments section. And while you're doing that, I wanted to thank some very special people that helped to make this possible. So Laurentian University, this was their idea. They are the ones that reached out to Science North and said, hey, we have an idea for a Let's Talk About COVID-19 series, and we jumped on board. So specifically, Dr. Tammy Eager and Jillian Schultz are the ones that initiated this idea. So thank you to you. And at Science North, there's some special people that made this possible as well. So we've had a whole series of Blue Coat hosts, but there are 2 people that we could not have done this without, and that is Renata Brandt. So Renata has been the technical wizard behind the scenes. Dr. Brandt is a graduate of our Science Communication Master's program. Originally from Brazil, she's been a fantastic addition to our team, and we couldn't have done it without her. And she's supported by Julia Ehrlich in our marketing departments. So thank you to you and all the other folks at Science North that made this happen. In particular, at Laurentian University, I have some extra shout outs. So Jonathan Mignot, Patrick Demers, Sean Malley, and Jean-Paul Rains have also been behind the scenes key people to make all this happen. So it literally takes a village and an army to pull together sessions like this, but they have been incredibly powerful and valuable for our community and beyond. So, c'est mon plaisir de prendre quelques minutes pour remercier toutes les personnes à Sciences Nord, à Laurentienne, partout, qui ont travaillé tellement fort pour rendre cet événement possible. Celle d'aujourd'hui, puis les 5 autres aussi. Now, we are looking forward to seeing your topic ideas. And before I sign off and say thank you again, just a couple of upcoming notes from things that are coming up with Science North. So 7 days from now, we will be celebrating Canada Day nationally. And usually I know that we all come together and we love, the big party that we have at Science North, and we will not be doing that this year. We will be having a national Canada Day celebration that Science North and the city of Greater Sudbury have been invited to participate in. So on July 1st from 2 to 4 p.m. and then from 6 to 8 p.m., please tune in. We have the most incredible program that features people and places of our region. And I think you'll be really proud to see us featured nationally. And then following that, watch for news because it's coming soon for Science North to reopen. And I wanted to specifically give a thank you and shout out to all of you and Public Health Sudbury districts in helping us to plan the way that we are going to safely reopen and welcome all of you back to our science centers. Thank you also for being such fantastic science communicators. You are stars in our community, and we're so proud to have had you here. Merci. Thank you, Miigwech. Have a wonderful and safe day, and we will see each other soon.
Thanks, everybody.
Bye, everyone.
Thank
Bye,
you,
Renata.
everyone. What an awesome session.
It was so good.